and welcome to Let's Just Do This. It's my great pleasure to welcome Cindy Simmons to the show. Welcome.
Thank you. So thermography, and I guess today we're mostly speaking breast thermography, is a test that uses an infrared camera. And that actually came all the way back from the wartime where they had infrared. You know, you still see it on TV, the guns with the red, and they can see the heat through the body.
Right.
Yeah. So thermography looks not inside the body, it looks for the heat coming off the body. So for anything, breast or any other physical issues to do with inflammation and heat in the body, close enough to the surface of the skin. It's used probably mostly for breast thermography.
Right.
Although we also do other body parts. And it is preventative in nature because inflammation happens early on in the process. So instead of waiting till we, at a certain point in disease, we're looking at inflammation, how the blood vessels are doing, is the heat the same on both sides is what we're looking for. So kind of in layman terms like hot spots.
Right.
And how the blood vessels react. And it might even show you hormonal imbalances early on. There is such a stigma out there with, is it mammography, over thermography, or one or the other? If you come in, like in thermography, in your report, there's a risk rating. And if you're high risk in thermography, the report will say, you know, it's time for, you know, maybe an ultrasound or a mammogram at this point because you're now high risk. Right? So it's not one or the other. And it's actually apples and oranges, where a mammogram is an X-ray that looks for lumps.
Right.
And that can take up to, 6-8 years to show up big enough. Where thermography looks at inflammation early on in the process. So it really is not the same. So it really should be part of your breast health approach.
Right.
Well, that all came from, like, you know, the statistics say that 85% of breast cancer is due to estrogen dominance, so an issue with progesterone, estrogen in the body. So that's really, really important. So to me, breast health and hormone health are linked. And in your report too, it shows up. Like if we see there's certain patterns that show up in thermography, if there's an issue already with hormones, you can now do something about it. So my next step for people when they come in and they ask, yeah, now what? I have this report, now what? Is really like, have your hormones tested. Because we want to prevent that estrogen dominance, as we call it.
Right.
And there's a lot we can do. It's not only about bioidentical hormones, it's about lifestyle changes, chemicals out of the environment, on the skin, everything else. And
Right. Our diet.
the diet,
food.
the biggest probably, and
Yes.
the one that most people don't like.
To hear to change.
And people always say, like, you know, oh, it's too expensive to eat organic. What are you talking about, Sin? You know, I always tell people, well, for me, I have a 15-year-old daughter. This is my insurance plan, right?
Yes.
Like, because if I eat healthy and she eats healthy and I watch the hormones in the diet,
Yes.
that's a huge bill, really, just right there, right? So, yeah, I pay a little bit more for the organic food, but lifestyle and prevention is just, really important to me.
And there's lots of ways that we can reduce the amount of hormones and chemicals that we're being exposed to, even if it's not just organic. There's lots of different ways. And that's what I love about holistic health and building a team around you so that you can find various ways to talk about that.
Of course, thermography is also used not only for breasts, but we can look at cranial, dental, thyroid is important. Any disease close enough to the surface of the skin. So arthritis, fibromyalgia, injuries. So in injuries, I think chiropractors use it for spinal. You can see pain syndrome, so you can measure treatment before and after, like having images before and having images after to see if what you're doing is actually...
I love that.
Yeah.
Whether it's having an impact. I love, because we are visual people. And often what's going on inside our body, especially because so many of us are not connected to our bodies, that we we need sometimes to be able to see the evidence in front of
The
us.
pictures are great, right?
Aren't
We
they?
all think in pictures, and so seeing a picture, it's like having a picture of your inflammation.
Right. So when somebody comes to see you at your clinic, what can they expect? I think there's
To
always
be
the fear of the
very
unknown.
cold.
To be cold, yes.
Freeze to death, right? Because the room that we do thermography in has to be between 18 and 22 degrees because we are taking images of heat. So if you're too hot, you'll be one big hot spot,
Right.
And we don't want that. So part of the procedure is that we're cooling down in the room first,
Right.
while we do paperwork and talk and get you calmed down. And then a series of images is taken. We stop, and then this is the nasty part about thermography. We put your hands in cold water, in 10 degrees cold water, and that's to get the body in the fight or flight reaction. So the blood vessels should be contracting.
Right.
So in disease, sometimes if you have something growing, those are new blood vessels, and they only dilate. So we want to see what the blood vessels are doing. We wait a couple of minutes, and then we do the test again. So the report has the before and the after.